Doctor, I heard and I saw it on YouTube, Instagram, 12,000 units transplantation. I want 12,000. Doctor, is it really true? Can anybody have 12,000 grafts? You always say 4, 5, 6. But I saw one video, 12,000 grafts. Is it correct? Is it true? Is it justified? Will it work? These are the questions that we face from patients. This is a very logical question and worth answer. Let us look at some basics first. When we first think of transplants, we think of this as a donor area. This area normally has about 12,000 to 13,000 units. In some people it is even less. But in Caucasians, in Europe and America, they have a larger head, dolichocephalic head. They may have 15,000 or 16,000. Then next area is about beard. In Indians, we take only from here because we are brown skinned people. If you take here, it will show. So you can't take here. Usually 1,200, 1,500 is what we can. In some people, it may be a bit more. Then chest hair. If somebody has good chest hair, then another 2,000 from there. Now, if you look at it in any place, we take maximum of 25% in one session, 50% over a lifetime. We never take more than 50%. Maximum in Indians is about 6,000. Maybe in Caucasian set, it may be 8,000. 1,500 to 2,000. So that brings it to about 8,000. Just another 2,000, about 10,000. This is over a lifetime. It cannot be in one session. So, if a person has a good donor, if a person has a good beard, if a person has good chest hair, we are looking at about 8 to 10,000 units over a lifetime. Now, this area originally had something like 25 to 30,000 units. After all, this area is 2.5, 3 times more than this area. So now you tell me, where will we get 25 to 30,000 units? So everybody please understand, it's a mathematical compromise that you start with. In any treatment of baldness, the maximum that we can do in one session at about 25% of the hairs that are available is around 5, 5.5, in some cases 6. Or a lifetime, it can become 8, 10, 11, 12. I had done long back, you can see this publication here, body hair transplantation. Over 4 or 5 sessions, I had done, all these photos show, we had done about 9,500 units or so, and he had very good result. So, unless you take from everywhere, you can't get such a large number. You can't get from everywhere in one session. It will need more than one session. So, mathematically, this is not something which we are convinced about. Now, let us examine it from another point of view. Supposing you take out 50, 60, 70% of the units here. If you take them out in one session, how will it look? Look at this. It will look ghastly. See, when we make holes, we are making tissue damage. We are taking a cylinder of skin out. And they are all in very small area. So when we are making 4,000, 5,000 holes here, there has to be normal tissue in between for them to heal. That is why when we do the transplantation, we take alternate hairs, vertically, horizontally. In our cases, donor shock loss doesn't happen because we do not disrupt the underlying vasculature. But if you extract it unwisely, as you can see here, it will cause donor shock loss due to microvascular damage. You see this photo here. The blood vessels in the skin are arranged at 3 levels. Uppermost level near the epidermis, outer layer, middle level, and a lower level. So if you disrupt this, the entire area, the blood supply is affected. Likewise, the nerve fibers are also affected. Overall healing is affected. And the area looks bad. Now I am going to show you one slide here. Previously it used to be said FUT scar is bad, FUE looks good. Now see this here. This is FUE. How horrible it is looking. Would you like to have a scalp of this type by extracting too much? And look at this photo here. You have an FUT scar and an FUE scar. So if you extract too much in FUE, then what was wrong with the FUT? Strip technique. So please understand, nature has given us limited amount of hair. Because of our greed, if we try to damage too much, what will happen is abnormal healing, abnormal result. This is what will happen. Now, having said all this, let us come to a third issue. A hair transplant clinic charges you by unit. So the more you extract, the more the patient pays. If I can give you result with less number of grafts, you save money. Now, for example, it is a well-known fact that 50% of density is enough to create 100% of cosmetic density. What that means is, even if you are putting 50% of the original density, you will still look very good. So, why should you plan too much? Then, looking at it in yet another way, if you plant it everywhere, even where there are hairs which are capable of growing, just because you want to extract more and want to charge more, then what about regenerating the hairs? We have so many therapies now for regeneration. Drugs are there, lasers are there, regenerative treatments like PRP, scalp automicrografts, hair follicle growth factors, all are there. They are all far cheaper way of preserving the hair than keep on extracting. Now, a third angle, if you extract everything now, where will you get remaining hairs if you were to become bald? So for all these reasons, it is not wise to extract too much. Now let us come to one more aspect. If I can give you result in 3000 grafts at certain cost to an Indian patient, am I ethically correct in saying I will give you result in 6000 grafts and charging the patient double? Is it not a relevant factor in Indian patients? In Indian patients, they have a limited budget. Our job as doctors is to cater to everybody. Instead of their paying capacity, we have to do something for everybody. So, because of these things, we have to be mindful of these kind of issues. Now, what is the solution then? Solutions are very simple. Preserve hair by medical treatments, get new hair by transplantation. This is a rule for everybody. Second rule, get the best donor scalp. Do FUT and FUE for the best result. Then go to beard and the body. Remember, everybody doesn't have the body. Number 3, there is a difference between the Caucasian head and the Indian head. Indian head is much smaller, so the number of hairs we get is much less. So do not be misled by what you see on internet that somebody got 8,000, somebody got 10,000. Please do not be misled by it. And number 4, please choose the most economically viable, scientifically optimum method of treating baldness. And that is what is the important thing. And at Venkat Center, that is what we do. We have published this paper, Combinational and Rotational Therapy for Wholesome Management of Baldness. By using all the different modalities, we try to strengthen the hair, we try to stimulate the hair, we try to activate the hair, we try to regenerate the hair. And then where none of this is possible, we try to replace the hair by transplantation. By paying attention to all the different types of treatment, nutrition, lifestyle, and doing the transplantation efficiently, economically, we give you the best results. That is the final message that I would like to give. I hope it has opened your eyes as to why these giga sessions of 12,000 units are unrealistic, unacceptable. Hope you like the video, circulate it, share it, and send us your feedbacks. Thank you very much.